Good morning, everyone. Bonjour à toutes et à tous. It's good to be here this morning. I'm pleased to be joined this morning by Vicki McKenna and registered nurses and nursing students from here in Toronto. Vicki is the first Vice President of the Ontario Nurses Association, and I want to start by thanking her and the 60,000 registered nurses that she represents for the work that they do in our hospitals day in and day out. Nurses save lives. Nurses provide exceptional care to patients. And nurses know how important health care is to the people of Ontario. No matter who you are, no matter where you live, no matter how much money you make, your health and the health of your family comes first. And it should come first for the government too. Votre santé doit toujours être une priorité absolue. But today, the Liberals are forcing our hospitals to make decisions based on dollars and deficits rather than what's best for patients. Over the past year, hundreds of dedicated nurses have been cut from Ontario's hospitals. Nurses who should be helping patients, but instead have been handed pink slips. Vicki can speak to the deep cuts that registered nurses have seen and what that means for patients. But this morning, on the first day of Nursing Week, I'm here with one message for Premier Wynne. Enough is enough. The Premier's deep cuts to nursing care in Ontario's hospitals must stop, and it must stop now. For 4 straight years, the Liberals have frozen hospital budgets. And once again this year, base funding for Ontario's hospitals will not keep up with the growing needs of a growing province. Because of the Premier's bad decisions, it's becoming more and more clear. Healthcare is the silent crisis of the Wynne government. Fewer nurses mean less care for patients. And less care for patients is not something that I am prepared to accept. I will not watch as nurses continue to be cut from Ontario's hospitals. This morning, I'm calling on the Premier to stop any further cuts to nurses in Ontario's hospitals. It's time for a moratorium on nursing cuts. Arrêtons de congédier les infirmiers et infirmières. Arrêtons. Il est grand temps. We know that you cannot improve healthcare by cutting nurses. You cannot help patients by laying off the very people who provide exceptional patient care. In the coming days and weeks, you'll see New Democrats in every part of the province speaking up for nurses and standing up to protect patient care in Ontario's hospitals, because all Ontarians deserve health care you can count on, and that's exactly what New Democrats are determined to deliver. I now want to ask Vicki to say a few words about the cuts to the 60,000 registered nurses that she represents and what those cuts mean to patient care, as well as introducing the nurses who've taken time out of their day to join us this morning. Vicki?
Thank you, Andrea, and thank you for coming today this morning. So today is the first day of National Nursing Week 2016 in Canada, and it's a week of celebration for nurses across this country for this vibrant profession of nursing and all that nurses do to ensure that their patients receive quality care. I'm certainly proud to be a registered nurse and honored to be the first Vice President of Canada's largest nursing union. As Andrea said, we're over 60,000 strong now. As a part of the Nursing Week celebrations and activities, a number of registered nurses will be in the gallery today at Queen's Park during question period to watch the MPPs read the petitions calling for an end to the RN cuts. Here with me today are 4 nursing students, Silene, Catherine, Christina, and Agnes, and a registered nurse leader from University Health Network, Cindra McGoldrick. RNs in every corner of the province have collected thousands of signatures now, thousands of signatures from concerned Ontarians who want to know that when they need it, they can access expert, safe, quality care. Registered nurses are the front line of healthcare, providing safe, quality care to Ontarians 24/7, 7 days a week. We are the eyes and the ears of the healthcare team and possess the critical skills, education to recognize and take quick action when our patients are experiencing a change in their condition. Nurses know how important our frontline bedside care is to our patients. Research confirms and has shown that when RNs are at the bedside, patients do better. Yet it seems that each and every week we receive notices yet of another round of RN cuts from an Ontario hospital. We've seen 169 cuts at Windsor Regional, and we've seen massive cuts at St. Joe's Healthcare in Hamilton, just to name a few. But nurses know that unstable patients need and deserve their care from specially trained registered nurses. This province is scraping the bottom of the barrel when it comes to the ratio of RNs to the population. Only British Columbia is worse, and we seem to be racing to catch up to them in this dubious distinction. For Canada, the average RN to population ratio is 836 registered nurses for every 100,000 residents. In Ontario, 714 RNs per 100,000 population. And that number drops with each and every RN cut. And hospitals continue to cut registered nurses. We have a total of 1,440 RN positions that have been cut since the beginning of 2015. And to put that into perspective, Ontario hospitals have cut 90 RNs per month or 3 RNs per day in the past 17 months alone. That's the equivalent of 2.8 million, yes, 2.8 million hours of registered nursing care has been eliminated. We have repeatedly called for an immediate moratorium on RN cuts. We need more RNs, not less. As our population ages, our patients become more complex and acutely ill. RNs are educated to care for such patients, those who suffer from multiple health conditions and whose health outcomes are unpredictable. And that's exactly the type of patients who are in our hospital beds in Ontario now. What studies have shown over and over again is that RN care improved the health outcome of patients, reduced expensive hospital stays and readmissions to hospitals, and more RN care is associated with reduced death rates and complications as a shorter length of hospital stay. It's well past the time that the Ontario hospitals staffed up, not down, and stopping the RN cuts. Our hospitals must be funded to at least the annual inflation rates, and population growth must be accounted for. And currently, that's not what's happening. Nurses know that our hospitals are hemorrhaging RN care, and patients are paying the price. Now we're saying enough is enough. I want to thank Andrea Horvath for standing with ONA's 60,000 registered nurses and allied health professionals, as well as the 14,000 nursing student affiliates, and calling for an immediate moratorium on the nursing cuts. It's time, and enough is enough. Thank you very much.
Thanks very much, Vicky, for your important insight into what's happening in Ontario's hospitals with the cuts to registered nurses. I'll take any questions that you might have.
That's all very clear, so no offense to the nurses.
It's okay, we warned them.
Okay, but we're all like, do you have any questions for Bob Shirelli in the house today?
I actually haven't done the question period lineup, but look, Mr. Shirelli knows what he said, and he needs to do the right thing and make a proper apology, and the Premier actually needs to take him in hand and deal with him in a way that's appropriate. My belief is the appropriate way to deal with Mr. Shirelli is to remove him from cabinet.
Do you have any response to the Premier's announcement on Friday that it was former MPP Kim Crater was one of the two MPPs who had given the
well, I mean, I guess it raises more questions than answers in terms of the announcement that she made on Friday, but any detailed kind of information about that needs to be asked of the Premier.
Do you think they're trying to change the channel on Shirelli with that? I mean, it's an odd way to change the channel, but...
Well, you know, that's an interesting observation. The press conference that they had did happen to be in Ottawa at the time, which is where Mr. Shirelli holds his seat. And so I wouldn't put it past the Liberals to try to change the channel on one inappropriate situation by raising, the details of another. Having said that, those details are still really with the Premier. So in terms of any further information, it would be her that would need to respond to that.
Good.
Okay, thanks everyone.
Thank you.
Thank you.